In our study, looking at patients on active surveillance with prostate cancer, we showed the risk of upgrading, of again getting a higher grade cancer developing, is lower the healthier your diet is, per the USDA's healthy eating index. And in fact, on this 0 to 100 scale, for every 12.5 points, you can increase the healthiness of your diet by this metric. You can lower your risk of an adverse grade reclassification event by 15 to 30%, which is just incredible if confirmed, if true, et cetera. We also looked into inflammatory index and diet's low inflammatory potential, but we could not see a benefit to a diet low in inflammatory potential in this particular study.
So when you say the healthy eating index, what is that?
So the USDA and the National Cancer Institute, starting in 1995, then again later in 2015, 2020, they came out with prescriptions of what they think would be a healthy diet, based on the best evidence at the time. We used the 1995 HEI, which was in use around 2000, 2005, 2010, which is when this study started. The healthy eating index, again, is abstracted to a 0 to 100 scale. And at the time, the questions were about how many grains, how many vegetables, how many fruits, how much milk, how much meat you're eating, and are you limiting your total fat, saturated fat, cholesterol, sodium intake, and do you have a variety of foods in your diet? So again, it's not really the food pyramid, but it goes all the way back to that old concept. And now they're refining this into this sort of scale. And believe it or not, in this 1995 iteration, 2 to 3 servings of meat, depending on your caloric intake, which is basically one serving's like 2.5 ounces. So 2 to 3 servings was not unreasonable. And that was actually correlated with what was thought to be a healthy diet, some dairy as well, but predominantly grains, vegetables, and fruits, and lower total fat, lower saturated fat, and lower sodium would get you a healthy eating index score that was higher and higher. And on average, Americans were in the 60s, which is not that high score. And the higher your index was, the better chances you had to not progress if you had a diagnosis of prostate cancer.